Perfect.
It's okay. The live stream hadn't started yet, so.
Thank you so much. No, that was a test and you all passed. So yes, thank you. Yes, okay, so we do have one more section before the discussion section. And it is with our grants management office. And so we have two staff here, Shirley Bird and Carla Hall. And so they are going to share with us some information on what we do or what CDC has to offer in terms of opportunities, how to find them, and then answer any questions that you can have. So a lot of the information that they're going to share with us, we want you all to share with us as well. And a lot of the information that you will share with us, we will take back and see how we can incorporate that information to make the process a lot more user-friendly and a lot easier in terms of clients or cooperative agreements. So with that said, I'm going to hand it over to my friends, cousins, colleagues, and again, apologize for skipping to discussions. So please repeat.
Yeah, we've all been traveling so much that it's like.
So that's the service. My name is Carla, and
You go next.
Oh, the last one.
Oh,
We've been to Oklahoma City, Phoenix, Montana, and then this was the last one.
Please. Next one. So as far as the and we'll also have application tips as well as how we look at the information as far as and for those of you who are trying to there's going to be a host of useful resources at the presentation. Just encourage you to take a look at those resources as possible to be ready for the I plan to be that is it's the truth and then you have resources to so as far as the education grants, I know that many still CDC and so we have to provide sufficient recent grant statistics. We recognize that CDC is globally recognized for conducting research and investigations and actual approach. But what separates us from our peer agencies is that we apply research and findings to people's daily lives to agencies. So to be most efficient and also impact, we focus on 5 strategic areas. First one is supporting stable departments, improving leading costs of debt, strengthening surveillance and also health policies. Take a look on the screen, you see that fiscal 22, the way that we achieve much of our work is through entities in the U.S. and abroad. And so fiscal 22 managed over 5,900 grants to over 2,500 recipients, and that generated than 14,000 actions for the year of this 22. So very, very busy at the moment because as the years unfold, the number of actions that we are increasing.
We have made over $9 million in public health programs research around the world, and $75 million to organizations. And then we also published 107 website opportunities to let hundreds. So this slide as well as the next one kind of gives a snapshot of our current tribal funding initiatives, not just for one, just the overall portfolio. So these are some of the programs, the Good Health and Wellness in Country. This is where we have provided $19.3 million in funding for the 5-year period to 27 tribal organizations. And the purpose is to improve American Indian and Alaska Native tribal health, focus on promotion and chronic disease prevention. And then we have the supporting tribal health capacity, virus preparedness and response. This will be ending soon. We provide $152.8 million to 336 tribal recipients. And of course, that is to support the COVID-19 emergency response efforts. We also have the tribal epidemiology centers, public health infrastructure, and that investment is $8.5 million investment for 12 tribal epidemiology centers. And the purpose of that is to build public capacity and to promote health and preventive disease in American Indian and Alaska Native communities. Next slide, please. And then next we have the Referral Practices and Wellness in Indian Country program, which is about $1 million that funded for 5 years. And the purpose is to support chronic disease prevention and wellness in American Indian and Alaska Native disease. We have the Tribal Public Health Capacity Building and Quality Improvement Program. Again, approximately $5 million annual investment for 5 years to 26 tribal organizations. And the purpose of that program is to strengthen and improve public infrastructure and performance of tribal public health systems. And then our newest program is Strengthening Public Health Systems and Services in Indian Country. And here, that's fund of 25 federally recognized American Indian and Alaska Native tribes and regional designated organizations. And the purpose of the funding is to help improve public health outcomes and lessen health inequities in the country. So shifting gears just a little here, we have information about CDC tribal data, information and resources. If you haven't done so already, I encourage you to go to our CDC website, and the link is shown here. And you can go there and learn more about tribal and Indian organizations. There's information on budgets, funding opportunities, and then there's also a section on grant writing resources. So that's a website that you want to flag and have your favorites, sure. Next slide. So let's talk a little bit about financial system acquisition mechanisms. So today we're discussing financial assistance mechanisms, which are grants and agreements. Very different from acquisition mechanisms. Acquisition mechanisms, standard contracts or purchase orders or task orders that are governed by the federal acquisition regulations. Those are not what we're discussing today. Financial assistance, which is grant and cooperative agreements, they are lit for the primary benefactor is the general public. So basically, under financial assistance, funding for the general public, whereas for acquisition mechanisms, when those are put into place, the primary benefactor is the so speak about grants and cooperative agreements. Technically, the difference between those two, both financial assistance umbrella, is that cooperative agreements require substantial So the boarding agency is substantially involved in some way with the performance activities that are outlined in those. So it's important to note that this collaborative role that we play under a corporate agreement, it is different from the standard monitoring activities that are required no matter whether or not it's grant or contract, excuse me, grant or agreement. So substantial involvement is that expertise. We have a working agreement, but whether it's a grant or a cooperative agreement, we still have to do our normal oversight and monitoring activities for either mechanism. And we'll talk about that next. Other differences that you have a contract. Basically, you are buying services, services for them, and then you pay for the services after the services have been provided. Whereas in the financial assistance program, typically 90% of the time, it's paid. So again, the focus is very different. It's not all that the government needs is what for financial assistance where contracts are federal acquisition regulations. Your financial assistance, the administrative regulations for financial assistance is 2 CFR or 200, the regulations. And HHS's limit to that is 45 CFR part 75. And then within the agency, we have our implemented guidance, which is have the grants administration. Thank you. So to kind of drive home the differences between substantial involvement and standard oversight activities, we wanted to kind of highlight what typically would happen no matter whether or not you're working, and that's what you see currently. So over the course of the grant work, which is typically anywhere from 4 or 5 years, CDC is responsible for oversight and monitoring. And those activities are things that you can see here. Approval of receiving work plans, conducting site visits, evaluating progress reports, providing post-award assistance, ensuring that recipients compliant with the public policy requirements on the terms and conditions of the award, conducting enforcement activities if needed. Also, we have a recipient that is designated as high risk, which we have very, very few that are in that category. But if we do have that, then there might be a need to have post monitoring done more frequently. And then also reviewing and evaluating performance after the project ends. So these are again standard on-site monitoring activities that would occur no matter when we agreement. So substantial involvement activities for partner agreements, on the other hand, requires something additional. And this is where you may have CDC staff collaborating or participating in activities that are specified. Or you may have CDC staff in decision making during specified milestones as particular goals. There may even be certain goals that are substantially involved as you move from one phase of the project to the next. But all of this will be spelled out very clearly and succinctly in the notice of opportunity. So again, substantial involvement, that's a big piece. It's not there in the grant. And the minute that you decide that we are saying that this program requires the agency to be actually substantial. And it has to be spelled out very clearly. So as far as recipient roles and responsibilities, we recognize that we have the authorized organizational representative. So when grant applications are signed, that individual, the AO, is the person that holds the requirements. We have that particular organization. And they agreed that the organization will assume the obligations imposed by the statutes, regulations. So that's one major organization representative. And we also have principal investigator, program director. This person, of course, is designated by a recipient, and they provide the technical direction of the project. They're also responsible for conduct of the project. Now, in addition to those major roles, there's also certain responsibilities. And so the recipient must have written policy requirements for financial management and comprehensive internal controls for program monitoring, accountability, maintenance, bank accounts, cash management, account systems, asset management, information. So again, the recipients required in our staff of services, you're checking particularly to ensure that we have these checks and balances in place. Others receive federal funds. You have to be able to demonstrate that they can manage their financial management controls in place to be able to manage federal funds. So we'll Shirley to speak about pre-application and also this.
Really heard I can branch chief policy risk branch also services. We're going to talk about some highlights for the application. First step in looking for and understanding funding is given to the website. It's very important that you register as soon as possible and that you look through that website. There's a lot of really useful applicant training on the grant side of tickets are really well. Right? That's right. Most folks are probably very familiar with them, share with others. Once you get to know grants like that, you will start the registration process. Registering with Sam does management, and understanding that what that process involves, and then start. So as I mentioned, the first opportunity inside this is the website. The majority of all federal funding opportunities are available. This is where you'll find those opportunities. This is where you develop your application and submit your application. Federal funding, regardless of the agency that is provided. Here's an example of the grant website, which registered people want to search for grants, search for forecasted as annually what funded about the course of this year. So you can see what's coming out today for those opportunities. And search for posted what's current, see what currently seeing. Next slide. And one thing that you want to really focus on is eligibility. There are certain funding opportunities, which Carlos spoke to earlier, in the CDC, that target tribal organizations. However, you're not limited to those funding opportunities. Most federal opportunities, competition, submit an application. So if you're looking at eligibility, make sure in addition to check the Native American tribal organization boxes, check the open too, so that you can get a broader view of what's available. Next slide. Also, a very useful area under the applicants is this applicants training for new applicants for federal funding. To help you in developing your applications, doing your registrations, and even what to expect, get it. There's a lot of user here, and so I think, you know, FAQs, but I really important to the training aspect. Next slide. Okay, so once you familiarize yourself with this, again, you want to register with Sandbox. It's mandatory. Anyone is seeking federal funding. On the homepage, you want to get started with registration. There's a checklist. This checklist is valuable to and making sure that you have all parts and all necessary documentation to submit your application. It takes some time for all of the validations. There's multiple levels of validation with the CM.gov. So if you're new, understand that it's going to take 30 minutes. If you have existing registration, no registration, want to in the August, please don't wait until August to start the process. To figure out how to start at least 45 to 60 prior to the registration. If your registration expires, you are unable to submit applications for funding, it prevents us from being able to annual funding. We have a no phone for CM.gov registrations as well. So if you have some funding, your CM.gov registration is required, you won't be able to get that funding until the registration. Next slide. Here's another highlight of the registration checklist, and for CDC, there's the financial assistance award you can register. Federal assistance for acquisition, or like explain to those that are interested, they're both registered for all, but for to be eligible for financial assistance, have to register for the financial assistance aspect. Next slide. On the CDC grants website, there's a plethora of information on applying and eligibility. CDC awards. We have tips for preparing your grant application. There's understanding what our review process is, the level review process of any application. So, next. Once you have found a no vote program that you're applying to, you want to really no vote all of the requirements for the program and what the required documents are. Standard documents on the SF2 424, which is the application for federal assistance, the 424A, which is the budget. Then you have your budget and project narrative, and also risk assessment questionnaires, which is required for any federal funding to designate risk. Those things that you're trying of your organization. Next slide. Also, we have on the CDC Public Health website some additional grant writing guidance and tips, things to help you to strengthen your application. This is an area or to provide a lot more of for federal funding. So those are accessible. Next.
Sorry.
On the CDC website, they have its welcome package. Congratulations on receiving your award. And how to award to entire award. I'll just say go on. Congratulations to the $4. What the pieces of parts of those are records are strings attached to funds and set to those For new applicants, new recipients, CDC Foundation, Junction, CDC, Office of Consumer Affairs, Office of Service, developed, a federal grants training series. There's 3 modules to this. That gives a really good understanding of federal grants and managing federal grants. This training is available at the Consumer Affairs website as well as the tribal, the CDC tribal website. It's a really good basic training for new recipients. It also includes a really comprehensive records guide that really helps new recipients navigate adult, because it can be. So I highly recommend this for new recipients. Here's a list of useful resources, HHS grants information, the HHS policy statement, the 45 CFR 475, which is regulations for federal assistance for the CDC. This will be changing. Sure, when HHS adopts the 200 CFR. Here's some more useful resources, the CDC website, the funding page, our general terms and conditions, words, the budget guidelines, really strong budgets. Campus, and so that's the other questions. Well, the other things in oh no, we got one more thing, right? We got the round session.
So let's get our well, as we begin to wrap up this day I do we have this lovely circle of chairs that I'd like to and we traditionally close these summits with kind of a reflection between our tribal partners and our federal partners, and just kind of talking about takeaways and what we hope that each other are together. My friend Ed is going to be kicking us off and play it. There it is. So yeah, so if we can just migrate here, and this part so we encourage candidness, we encourage vulnerability, and so definitely